Good gynecological health means a woman is hormonally balanced, structurally functional, and harmonized in mind and spirit. Like a kitchen garden, vegetables don't just magically appear. Someone plants the seeds, waters them regularly, and nurtures them while they grow. It's the same concept with your gynecological health. It requires effort. In this episode, we look at 5 action steps to achieve good gynecological health. Step 1. A beneficial lifestyle. Living a beneficial lifestyle allows you to reap tangible health benefits. For instance, if you have been diagnosed with polycystic ovarian syndrome after experiencing prolonged irregular periods and difficulty in getting pregnant, the first line of intervention to alleviate these symptoms is to modify your diet and begin regular physical activity. The recommended dietary modification for PCOS is caloric restriction, which means reducing your daily caloric intake without depriving your body of essential nutrients. For example, you can switch from foods high in carbohydrates to foods low in carbohydrates and incorporate vegetables and lean protein. The recommendation for physical activity is 30 minutes of moderate intensity activity, 5 days per week, such as brisk walking, jogging, or running. Restricting your caloric intake and beginning regular physical activity may be challenging, but this lifestyle has beneficial effects on some symptoms of PCOS. You may regain regular periods and the ability to conceive a pregnancy, as studies have shown that weight loss of 5 to 10% is associated with an increased chance of getting pregnant. Step 2. Stay informed. Staying informed refers to utilizing reliable sources of information like books and websites to expand your knowledge on conditions like ovarian cysts, endometriosis, and uterine fibroids. But remember, one of your most valuable sources of information is your gynecologist, so be sure to ask questions. For example, you may need to discuss birth control options. Let's say you've had your first baby, then started on a particular contraceptive method or birth control. 2 years later, you've decided to have a second baby, and now you're wondering, is it safe to use the same form of contraception after childbirth? In this scenario, it's critical to select a contraceptive option that's most appropriate to your age, unique lifestyle, and medical history. For example, if you would have developed a deep vein thrombosis during pregnancy, which is a blood clot in your lower limbs, using an estrogen-containing birth control further increases your risk for life-threatening blood clots, and so is contraindicated, meaning it should not be used. Whether it be hormonal like the pill, barrier method like condoms, or placed inside the uterus like the copper T intrauterine contraceptive device, it's important to stay informed about contraceptive methods because the option you select can affect your health. Step 3. Self-monitoring. To self-monitor is to be vigilant about changes within your body, such as abnormal vaginal discharges, pelvic pain, or urinary symptoms like burning after urination. For example, every woman would experience a daily whitish, thin, and odorless vaginal discharge that may appear yellowish on contact with air. This discharge is not accompanied by vaginal itching or any other symptom and is called the normal physiological discharge. It's harmless as it consists of mucus, cells, and fluid from the vaginal wall. However, if a vaginal infection has developed, the discharge changes color, consistency, and odor. In the case of a vaginal yeast infection, the discharge remains white but becomes thick like cottage cheese and is accompanied by vaginal itching. In trichomoniasis, the discharge may be gray or green with a foul odor, whereas in bacterial vaginosis, the discharge becomes gray and fishy smelling. A woman who is self-monitoring would notice these changes and then visit a gynecologist for care. Self-monitoring also applies to tracking of one's menstrual cycle to note regularity, duration, and any difference in flow or symptoms such as pain or mood changes. These can be written in a personalized journal or calendar so that deviations from your norm like a missed period, heavy bleeding, or bleeding in between periods can be recorded to later discuss with your gynecologist. When you are self-monitoring your reproductive system, you'd notice abnormal changes and seek early intervention. Step 4. Act early. When it comes to gynecological issues, you can't wait. Act early before a minor issue becomes a major problem. For example, if you notice vaginal bleeding or spotting after sexual intercourse, you should have it investigated promptly. Postcoital bleeding can be caused by menstruation or vaginal or cervical infection, but it can also indicate a life-threatening problem like cervical cancer. The clinical way to determine the root cause of bleeding or spotting after sexual intercourse is to have a pelvic examination. This would involve inserting an instrument called a speculum into your vagina to fully visualize the cervix to assist in detecting the source of bleeding. The pelvic exam also allows your gynecologist to perform a pap smear to determine the health of your cervix, and if an abnormal cervical growth is seen, a tissue sample or biopsy is performed to collect cervical tissue, which is then sent to the lab for testing. If the results of the biopsy later reveal cervical cancer, it can be managed in the early stages before it progresses unchecked to advanced cervical cancer that may spread to other organs of the body like the kidneys, the urinary bladder, and the lungs. Acting early on the first sign or symptom of a gynecological issue is a critical step. Early detection allows for timely interventions, which increases your probability of returning to good gynecological health. Step 5. Yearly gynecological checkup. Even if you're not experiencing any gynecological problems, scheduling a yearly gynecological checkup is important. The gynae checkup is used to perform clinical screening like pap smears, pelvic exams, and other necessary evaluation based on your age, medical, and family history. The purpose of this is to detect abnormal changes within your reproductive system so that abnormalities can be managed in a timely manner. For instance, you may have had your last gynae checkup 3 years ago and the results were normal. Naturally, you may think you won't need another checkup before a few years, but some gynecological cancers, like high-grade serous carcinoma, a type of ovarian cancer, can be aggressive and progress rapidly, spreading quickly to other pelvic organs. It may also spread to the peritoneum, which is the lining of the abdomen. This then causes symptoms like abdominal bloating, pelvic pain, and feeling full quickly when eating. Another important reason for scheduling your annual gynecological checkup is for monitoring changes related to physiological transitions. As we advance in age, we transition to a phase where menstruation stops, called menopause, due to a decline in blood estrogen levels, which is caused by reduced ovarian function. The period leading up to menopause, called perimenopause, can be accompanied by erratic vaginal bleeding, as well as hot flushes, vaginal dryness, and mood changes. If left untreated, these symptoms can greatly reduce the quality of our lives. From the reproductive years to the menopausal phase of a woman's life, I recommend a yearly gynecological checkup. As women, our gynecological health impacts the quality of our lives. When our gynecological health is affected, we feel unbalanced. When it is good, we feel confident and empowered to take action. So live a beneficial lifestyle, eat healthy, and engage in regular physical activity. Stay informed about gynecological conditions. Actively self-monitor changes within your reproductive system. Act early on the first sign or symptom of a gynecological issue. And even if you're not experiencing any gynecological problem, schedule a yearly gynecological checkup.